بسم الله الرحمن الرحيم. السلام عليكم جميعا. Good evening everybody. Welcome in Mrcs OSCE exam Salah course. This is the first lecture for this course and it's totally new. Before 2 or 3 days, I got booklet or notes from Edinburgh course, the best course of Edinburgh. And if you can do this, by the way, online for 3 or 4 days. So they will give you book about 150 pages. How exam is conducted and how to get marks like this way. So when some of our candidates send me this file, by the way, or send me this source. I sit and I look for it. I found the many important points. So I asked today, Doctora, 2 days ago, Dr. Maria, to prepare this orientation lesson from this book. The important points. Plus, this course given by Edinburgh, paid course, it's very expensive, by the way, will be shared as PDF in your drive. Okay, so all the book will be shared in the drive. But today, I collect some things from this course to tell you what is the important points and experience from our candidates, especially on May, who went test in May, what is the important questions and what is the struggles with them in May exam. Tamam? I discussed this before, especially in orientation lecture. Distribution of markets and distribution of stations. I think no need. To discuss this now. Okay. If you look for this distribution, 3 stations of anatomy. You have three stations in anatomy and the pathology, and you have 3 stations in critical care. From now, don't miss critical care. Why? 3 stations from 15 stations. So critical care, one of the most important points. Pathology, only 1 station. So you can study pathology or not study. It's easy. But for me, we will study pathology, and at the end, we will have only 1 revision lecture for all pathology. You can look for it only at the end, inshallah. Anatomy 2 stations, it will come from our mock or Salah snacks in anatomy, which will be discussed, inshallah, at the end, later. So anatomy, revision from that. Now, you will have 5 lectures of anatomy, 4 critical care, 4 pathology. Okay? These topics will be discussed today. Communication skills and examination, every section will discuss on the beginning of it. I will do another live session to discuss how to approach skills and how to get marks. Okay? This discussed already in orientation lecture, which I shared. This paper we discussed before. Okay? Now, I will come for anatomy. Edinburgh examiner, they are dealing with Salah. Again, what I am telling you now from Edinburgh examiner. They told in anatomy, the key point, practice identification of structures from mapping, surface anatomy, from imaging, from bones, and from perception. This means anatomy will come from this. You will find imaging, you will find the skeleton, you will find CT or MRI imaging. You can find also plastic model for liver or something like that, and the perception. The worst thing in this anatomy exam is perception. And this in UK, yes. In Cairo, yes. In Bahrain, no. So perception are the worst. So, especially in identification, the challenge in May now experience of our candidates in anatomy, the main challenge for them was identification of a structure. They told me all the questions asked in the mock and in the lecture are okay. And they told frankly by this way, anatomy or knowledge are coming from the course sources all, except how to identify the pictures are not clear. The pictures sometimes new. So your challenge now is how to identify some structures. So these structures will take from you about 4 marks only. And identification, identify will ask you where is the vagus nerve, where is the spinal accessory nerve, where is great auricular, where is the parotid gland, submandibular gland. We'll ask you this question to identify in prosection or in imaging. The challenge for them in May, this part. So how to solve this from now? Your practice in anatomy will be like I will tell you, inshallah. The exam questions and the examiners evaluate your ability to identify important anatomical structure, which can be encountered in surgical procedures. The relationship of any structure to the neighboring structures will be examined with a picture of 3 dimensions. Okay. In prosection imaging, يعني you can see this. يعني if we'll ask you to identify neighbor structure, we will give you very nice image like this. This in our book. So it's very easy to identify a structure here. Or you can find, by the way, these pictures came in exam in May. These 2 pictures. Or we'll give you another cut section in the brain MRI, and we'll ask you to identify this structure: cerebellum, cerebellar tonsil, fovea, corpus callosum, like this way. Okay. So for any neighboring structures will be examined in this section. There will be 1 minute to read the stem, and then 9 minutes with the examiner. So at the beginning, 1 minute to read the stem outside, then you have 9 minutes with the examiner. طيب, we wanted to see example for that. This is from our book. He will give you this picture. Can be as projection, can be on tablet. So maybe will not be clear like this. And very important here, when you will do practice in our book, you will do subgroups or a small group to remove numbers. You think it will come with numbers? No. We will have pointer and we'll ask you what is this structure, and we'll look for structure number 15 or structure number 1. So better when you are doing the practice from the book to remove this number, this labeled the structures by numbers, remove numbers. Start by this way. What I am telling now is very important in your practice. So this example of exam, without labeled numbers, he will ask you to identify arch of aorta, brachiocefalic artery, carotid artery, subclavian artery, vagus nerve. Okay. This complete station came in UK on May. So most of them they told we can't identify all structures because the projection or the picture not clear. Number 2, he will start to ask you the question which he shared already for you. Why there is hoarseness of voice with bronchial carcinoma affection of vagus nerve? Identify recurrent laryngeal nerve. What is the number 11? He will not tell you what is the number 11. He will ask you what's this number, and will put pointer for number 11. He will not find this labeled by number. What is the arterial supply? He's asking number 11. He's asking about thyroid. If you look for the thyroid, then he will start to ask you all questions about the thyroid, arterial supply, venous drainage, how many parathyroid glands, identify upper trunk of brachial plexus, what injury lead to arm flexion, loss of abduction and wrist extension, and what policy is caused by damage of C81 lower trunk. This is not the time to answer the question. After giving a lecture, you will find this discussed in person, inshallah. So, anatomy, like I told you, it will be bone, skeleton, it will be picture or imaging like that, imaging, plastic model, or some picture like MRI or CT or X-rays, it will be on tablet. Till now, clear? Now we'll come for knowledge or critical care. I told you critical care 3 stations, every station by 20 marks. You will have 1 examiner. So the 20 marks is distributed as 16 marks for the questions asked by examiner and 4 marks for professionalism. What does this mean? When you are explaining any question, you should understand what you are telling. You should understand what you are telling, because he will ask you to clarify. You have 4 marks when you are explaining properly for the examiner. If you will give him short answer and he told you what else, can you clarify what you are telling about or you are talking about? So it will be difficult. You will miss this 4 marks for professionalism. You have 4 marks in station number 1 critical care, 4 marks in station number 2, 4 in station number 3. So you have 12 marks for professionalism, which not by questions asked in this station, but by clarification for any answer. So you should understand what's written is exactly in the book. Applied surgical and critical care relies on learning about basic and the first principles of patient management. The areas tested shall be as follows: data interpretation, visual, and the laboratory. So he can give you a picture and they will ask you what is this imaging. Then can give you some laboratory investigation, asking you what in this finding in this lab, like the standard of obstruction, who will give you labs for the patient and EBG. Okay. Also in visual here, he can give you X-ray. Also, like in the standard obstruction, you will find the dilated loops. He will ask you what's this. So data interpretation can be X-rays, can be EBG, can be ECG, can be lab investigation. We'll start this session mainly by this way. This is to look at blood results and they come to a reasonable management plan by also looking at the patient vital signs. Interpretation of clinical data. This is looking at blood results such as arterial EBG, like we discussed now. Okay, then you will come for diagnosis and the management. Critical care management also, you are in a situation where sound and the quick decision is very important and essential. It may be related to a road traffic accident, active bleeding, or critical ill patient, like a patient of pelvic fracture or a patient with cervical spine fracture. This is critical care. So here you should take quick decision. Pelvic fracture, maybe patient is going for hypovolemic shock. We'll ask you here about shock, how to manage circulation. Or patient with cervical injury, he will ask you how to manage airway. So this related to road traffic accident or active bleeding or critically ill patient, like patient with intestinal obstruction. All this you have stations in our book for this. Remember, the following is very important. Have a sound rationale for all decisions. Always put patient safety interests first. Know your limits. Take help when needed. These people, it will ask you about patient he has identified and will ask you how to manage. First of all, you think that examiner is waiting how to do great iron incision, how to identify structure after great iron, external oblique neurosis, external oblique muscle, then reaching till the peritoneum, then identify ileocecal junction. I am orthopedic, but I know how to do appendicitis. Okay, appendectomy. Then ileocecal valve, identify it, then identify appendix, the tip of appendix, then you can remove it from the base and do ligation and cautery, you can do that. I think I'm talking by scientific words or this, or I'm wrong, or so JS, or I'm wrong. You are doing appendectomy by this way? Okay, for sure, yeah. What I'm telling you, this from my experience. This from my experience only. But you think I read that? No. No. Here in this exam, he will not ask you at all how to do operation. If we'll ask you, he will tell you frankly, you did amazing job. Can you give me, and you finished from your question, can you explain how to do appendectomy? So no marks for operative steps. Critical care, very important to tell him that I will inform my consultant, I will inform my senior, I will inform ITU registrar or HDU. So both patient safety first and know your limits. When you are prescribing antibiotic, if your patient has abscess, what is the antibiotic you will give to the patient? All of us will tell abscess, the causative organism is Staphylococcus aureus. So I will give for this patient flucloxacillin from part A. This is not accepted here. Better to tell, especially with patient who's taking antibiotics, to tell the examiner, okay, for this abscess, I will give the patient broad spectrum antibiotics after, according to the hospital guidelines, and after discussion with microbiologists, till culture swab results came. For example, abscess, how to treat the abscess, or what is the antibiotic we give, tell him I will take a swab first, then I will contact the microbiologist to take his opinion, and I will give the antibiotic according to the hospital policy or trust policy. Trust policy here in UK. So don't tell him I will give flucloxacillin. For blood transfusion, if we'll ask you, the patient needs blood transfusion, you will tell him, I will inform my consultant first, then I will give the patient blood transfusion according to his hemoglobin level and according to the guidelines, and after discussion with hematologist. This what this sentence means now. Patient safety is important. If you suggest or do anything that is going to harm the patient directly or indirectly, you are unlikely to score fail or borderline. So never say anything that will compromise the patient in any way. If you don't know, tell him I will ask my senior or I will ask my consultant. Also, don't say something you will do that you are not able to do in real life. If you have someone with respiratory distress and you have done everything available to you, don't say, now I will try to intubate. Your mom, Suzanne, she has this question in Al-Bahrain exam. Patient needs intubation. Examiner asked here, who will do intubation? So you tell me for ICU. He's waiting anesthesia consultant. Don't tell ICU or me. She, by the way, she answered this question wrong. She told the ICU. So it's very important. Even you can do that, should be by authorized person or consultant. You are being tested on professionalism and your knowledge and how you communicate your views to the examiner. This is what I told you about professionalism in critical care. Example of pathology station or this pathology also like critical care also. Okay? A STEM, middle-aged diabetic Chinese male with ulcer in nasopharynx on recent chemo and radiotherapy. This is a STEM. You will read it outside for 1 minute, then you will go inside and you will see this picture inside, and this also be outside. Then we'll start to ask you the question: what is the risk factor of nasopharyngeal carcinoma? Already in our book, by the way. Define carcinoma, differential diagnosis. What are other non-epithelial tumor can be here? The palpable lymph nodes, how to assess. Cytology versus histology. It will come, inshallah, in next session. Lymph nodes, you will do fine needle aspiration cytology or through cut can be done. So any palpable lymph node, you will go for fine needle aspiration cytology. He will ask you what is the differentiation between cytology and histology. For sure, you will be asked this question. And what is the advantage and the disadvantage between these two? A scale of radiation dose. If a swab grows hyphy, what do you think? If you look for this station in pathology, oh my God, what's this question? This nasopharyngeal carcinoma new station. It will go exactly like our book. It will it's taken in our book only 1 page. 1 page. You will keep it and you will go to the exam. You will find the same question. Same question. Fine. Example for critical care station. A stem will be written outside. A AF patient with perforated viscous. Okay. And this station, by the way, came in UK on May. they found this picture and ECG. So examiner will ask you, what can you see here? He will, before you read this X-ray, what do you check? Interpretate chest X-ray. He means here how, before what do you check? Means the way how to read X-ray. First you read the name of the patient, file of the patient, date of this X-ray, and if any previous X-ray, file number of the patient. This most important point we shared for you, inshallah, during the course, how to read ECG, how to read X-ray. We have a specific way to keep it and fill them in the exam. Causes of AF, name 4. Okay. If I will open the mic for anyone, will tell me many things here. I saw the checklist. Checklist means the original paper asked by examiner. All the people, they know checklist. You will understand what is the checklist, inshallah, with progress of our course. You will surprise what is written in the checklist, what examiner is looking for. Causes of AF, you can mention many, but he asked for. No, multiple disorder will not be active. Can be, yes, can be here. Yes, can be here. But wait, what I wanted to tell. It's written for him. If candidate will enumerate 10 causes without mentioning these 4 causes, don't give him marks. So he has in front of him 4 causes. Maybe we don't know. Look for this patient, perforated viscous. So what can be the causes for perforated viscous? To cause AF, sepsis. Agree or not? Yalla with me. Agree or not? Number 2, metabolic disorder, electrolyte disturbance. Okay. So for such a question, look for the patient from surgical site and what's the main causes for that. Then you can enumerate any other causes. Okay. So when you ask you 4 causes, remember this perforated viscous. Yeah, you can't miss it. You should tell it. This how to get marks in critical care station. Some of you some of you will tell me after the exam, he asked about the causes of AF. I told him 10 causes, but examiner not satisfied. Yeah, some of you will tell me that. I give him 10 causes or 10 reasons for AF, but he's not satisfied, Dr. Salah. He's asking for more and more. You understand why he's asking more and more? Because it's written in front of him in the checklist, should mention these 4 causes. This examiner, if will ask you more and more, is very polite and nice examiner. He wants to give you the mark. If examiner, you told him 4 marks, you finished? Yes. Next question. Means you maybe missed some questions, he will not give you the mark. I will not ask you. You told already. So don't be panicked or be angry when examiner is not satisfied about your answer. I want more. If we'll ask you more, he's helping you. He wants to give all what's written in the checklist to give you the mark. We'll show you this ECG and we'll ask you this question. This station came in my exam. What do you look at ECG? Explain finding. Why heart rate different between pulse oximetry and machine? Okay, between the ECG and the machine. Causes of AF we discussed already. Principles of management of AF. You will talk about rate control and the rhythm control like this way will be discussed inshallah for this session in our book. Thank you. I did combination in this orientation lecture from our material or our sources, and between the what requested exactly from the course given by the Mrcs. Okay, so how to study anatomy, how to study pathology, how to study critical care. I think everything is clear. Our plan and our schedule will be like what I will tell you. ECG, okay, before going for that, ECG, it's very easy. I am orthopedic. If you will give ECG or EBG for orthopedic in your hospital, he will tell you, oh, this patient needs fixation, urgent. Okay, this patient needs fixation. He will tell you that. Okay, absent B and the absent A in AF. Irregular rhythm, absent A, absent B. Okay, absent B wave in ECG and the absent A wave in jugular wave and irregular one. والله يا اسامه والله يعني you give ECG or EBG for orthopedic. So here you will find everything is clear, don't worry. By the way, they are asking about some questions in ECG and this article. Our coming plan, because I saw in the group you are asking about when the lecture will be uploaded like this way. Number one, lecture will be uploaded at 12 midnight today at the beginning of the day. So you have day 2 or second day of June, it will be upper limb lecture. The recording, not live, of upper limb lecture will be uploaded today at 12. With it, you will this in lecture group. And in notes group, wait. Sorry. Yes. And in notes group, you will find some important notes will be shared in notes group. So from where this notes group? Sometimes I have new question on May, not written in our book. So you will find the notes shared in notes group. Very important. These some questions are coming and asked before. So notes group will complete your study. In part B, you will not find the Salah bullet, Salah notes, monotes, Q5. We did organize very good organization. I collected all my notes and all the updated station I collected. I send for Muhammad, and Muhammad he put his notes and all in your book. So you have only one source of study named monotes. monotes means صلاح and monotes. يعني قلت له غير اسمها لكن محمد لسه ما غلطهاش بس عادي يعني. النوتس ديت انا هو اللي كاتبها. خلاص بس عادي هو فرحان بمونوتس عادي وانا فرحان بينه وبينكم يعني. So monotes is combination of صلاح notes and monotes plus the updated station. This our only source of study. When you will look for monotes and listen for the lecture, you will find me during the lecture adding some points are very important. Checklist not written in the book and will not be written in the book. So once you will hear I am giving you any question, stop the recording and write in your book. Our book is printable. So you can print and add what I am telling you. Very important. The target from that, why we are doing that, our book is distributed all over the world. So you should keep something, and the most important thing is to be done verbally only on the lecture. So don't think I have the book. No. To complete your study, you should listen for the recording. And this is why we are preparing OSCE to be recorded lectures, not live lecture. Because live lecture, I will give you many new information, not in the book, so how to write it. But in the recording, you can stop the recording and write. So the first day, which will be tomorrow, it will be upper limb lecture. Look for the lecture group and look for the notes group for any notes. After tomorrow, after the lecture, by 1 or 2 days, we will have at 7 or 8 p.m. KSA posting 2 stations of the topic. So you studied upper limb anatomy. So you will find two stations of upper limb like I discussed now. Two stations of upper limb will be discussed in posting and by writing. We will put picture in the group and we will give the question and they will give all of you 1 minute to answer this question. Okay. So we will do organization for it. If we will put the question, please take your time, 30 minutes before answering, to give other people chance to think about the question. So we will put the question and we will wait 30 seconds. Then all of you can put the answer. Okay, can put their answer. Then you will find the correct answer. The target for posting not to study upper limb again. The target for it to prepare yourself or finish from the lecture and come for these two stations to test yourself. I think these two stations will make you active to study the lecture, because if I will put the recording today, the recording tomorrow, the recording after tomorrow, many of you will start and know I can't come for meeting with you till finishing of anatomy. So I will find many of you, no, I am in upper limb. So for every part of anatomy, upper limb, you have two stations will be posted. It will be in the specific day, will be written in the group. So after upper limb, lower limb, we'll do that also two stations. And this will be for all knowledge stations. After every lecture, you will find the two stations for test your knowledge. Okay. After finishing of anatomy, we will come for another live session. It will be 10 stations for mock. It will be like I shared now. I will share the picture for you. Then I will start to ask you. These 10 stations will be written in the group. Who will select a station from 1 to 10? So some of you will tell I will take 1, other one I will take 2, 3, 4. Then in the live discussion, we'll do that. Posting question after every lecture, it will be with me, Shinoda Muhammad Rada. And mock for anatomy after finishing, it will be, and this will be on Zoom. It will be on Zoom like today. It will be with me, Maria, and Suzanne. Okay. After finishing knowledge, we'll go for skills. You will have another orientation before going for skills, inshallah. So you will find our course, especially on knowledge, five lectures for anatomy, 4 lectures for critical care, 4 lectures for pathology, and every part we will do 1 mock, and after every lecture you will have 2 stations will be done in the group. It will be a specific day. We will decide according to their duties also. It will be 7 or 8 p.m. before the next session. The plan is clear or not? About new posting, Osama, yes, this new posting, and this new posting not like part A, because we haven't Mrcs and the bus test in OSCE. No need for that. So these 2 stations mean what? A station like exam. Every station in the exam will take from you 9 minutes or 10 minutes. But on our discussion in the group, everyone will take from us about 30 minutes, because we will clarify some points, we will share some pictures, and we will take time to think about the answer. Please, when we will put the question, don't put your answer. Every one of you should count 30 minutes before putting the answer, because I want all of you to think first. Okay, maybe you are amazing or you are excellent, and the other is still not studying. So better to wait. So 2 stations. Every station will take 30 minutes, so it will be posting, it will be maximum 1 hour, inshallah. Okay. The target from that is to push you to study. هخليك تذاكر بمزاجك، غصب عنك تذاكر. ما هعمل لك ايه؟ ما بشوفكش غير في الاخر. So I will push you to study by this way. Our book already on the drive. If you joined the course and still you are not getting the drive, write your Gmail in the group. Write Gmail in the group, don't worry. ما انت عارف يا اسامه، Okay. All the live sessions will be after 15 of 8. So I decided to put some live sessions now for the mocks, for this posting. Okay. This live session, if you want to, for example, upper limb live, I can do it tomorrow. But you will see the difference between live session and between the recorded lecture. You are with me from part A, and you know our way. So let me explain what is the best way in teaching of this Mrcs, because I since 2015, I discovered the best way is if knowledge, fixed knowledge like anatomy, physiology, like this way, this better to be recorded. If you want interaction like mock exams or like recalls when we did, this better to be live session. Okay. So don't worry, we are arranging everything for you to finish from part B smoothly like you did in part A. Regarding the for center, I discussed in a previous orientation lecture, so I will not discuss today about center. You have the UK group for visa. You can join this group and ask your colleagues there how to get visa, what is the requirement, and don't worry, they will answer you, inshallah. Okay. Thanks for your time. I will finish from the recording, then I will open the mic to listen for any question. I don't want to be extended. This is yes, 45 minutes exactly. I don't want to take much time in this lecture.